Hello and welcome to Working Past Age 65, So What About Medicare? We have several objectives for this presentation. We will help everyone turning 65 to understand what they do and don't need to think about regarding Medicare. We will explain to those who plan on working past age 65 what they may need to do. We'll give guidance to anyone who leaves their job after age 65, whether voluntarily or because of an unexpected job loss. We will explain what you should do if you become reemployed after age 65. And we will highlight why Medicare eligible individuals should not take COBRA when they leave an employer plan. Age 65 was long considered the traditional retirement age for workers. Over time, we are seeing more and more people work well past age 65. Why? There are several reasons for this. The age of eligibility for Social Security benefits was originally age 65, but Social Security has gradually increased the age of eligibility so that anyone born after 1960 now has a target retirement date at age 67. Individuals may also recognize that they don't currently have enough savings to cover their living expenses in retirement. There are also many people who enjoy their work and want to continue to remain busy and active. Or they may be working towards becoming fully vested at their company in order to accrue certain benefits when they eventually retire. And many recognize that healthcare costs may rise during retirement, and they prefer to stay on an employer health plan. Regardless of how long you plan to work, there may be detours along the way. An unexpected layoff, a company closing, family obligations, or personal health issues. All of these events may force a change of plans. Before we look at the decisions you may need to make at age 65, let's review some basic facts about Medicare. There are three distinct parts to Medicare coverage. Medicare Part A is hospital insurance, which covers costs incurred when you are a hospital inpatient. Medicare Part B is medical insurance, which covers doctor services both in and out of the hospital, as well as other outpatient services such as lab work and radiology. Part B may also cover some prescription drugs. And Medicare Part D, which was introduced in 2006, offers prescription drug coverage to Medicare enrollees who have either Part A or Part B or both. Medicare Parts A and B, with or without a Part D plan, is known as Original Medicare. As an alternative to Original Medicare, Medicare Advantage plans, also known as Medicare Part C, combine Medicare Parts A, B, and D into an all-inclusive health plan. Advantage plans are offered by insurance companies and typically require you to stay within their network of hospitals and providers when seeking non-emergency care. So what are the requirements for Medicare eligibility? You must be 65 years old and either a U.S. citizen or a lawfully permitted resident for 5 years. Individuals under age 65 who have been deemed disabled and are receiving Social Security disability payments are also eligible for Medicare after 24 months of payments. The waiting period is waived if the individual has either end-stage renal disease or ALS, Lou Gehrig's disease. In order to qualify for premium-free Part A, you need 40 credits or about 10 years of working and paying FICA taxes. If you yourself have not earned enough credits, you may qualify through your spouse if he or she has earned sufficient credits. Even though the age of eligibility for Social Security has gradually moved up, the age of eligibility for Medicare remains at age 65. Every Medicare eligible individual has what is known as their initial enrollment period, which begins the first of the month, 3 months prior to your birthday month, and runs until the last day of the month, 3 months after your birthday month. So Medicare is giving you a 7-month window to enroll in Medicare. But there is a catch. The later you enroll within this initial enrollment period, the longer you will need to wait for your Medicare coverage to start. If you are planning on signing up for Medicare at age 65, you should be aware of your initial enrollment period and make sure that you sign up for Medicare in one of the 3 months before your birthday month in order for your coverage to start on the first day of your birthday month. Delaying sign up until your birthday month or any of the 3 months after means the start of your Medicare coverage will be delayed for up to 3 months. If you are beyond your initial enrollment period, over 65, and leave or lose your employer coverage, you have what is called a special enrollment period to enroll in Medicare. The 8-month window that's given to you is protection against any late enrollment penalties, but in most cases, you would want to time your Medicare coverage beginning to coincide with the end of your employer coverage. So let's look at a scenario where you've decided to work past age 65. We'll look at each of the 3 parts of Medicare and review the questions you should be asking yourself. We'll start with Medicare Part A. As we mentioned before, for most individuals, Part A is premium-free as long as they or their spouse have earned the 40 work credits. For this reason, people may enroll in Part A when first eligible, but decide to decline Part B if they're still covered by an employer group health plan. There is one important caveat, however. If your employer group health plan is a high deductible plan with a health savings account or HSA to which you contribute, you should not sign up for Part A as long as you're still contributing to that health savings account. If you're planning ahead, you would need to stop your HSA account contributions at least 6 months prior to signing up for Medicare Part A in order to avoid any possible tax penalties. Now we'll look at the question of whether or not to sign up for Medicare Part B. If you're covered by an employer group health plan, you need to determine whether there are fewer than 20 employees at the company. If so, you should absolutely take Medicare Part B, which will become your primary insurance. Your employer plan will then be secondary to Medicare. If you have any questions or concerns, it's always wise to check with your employer's human resources or benefits area to confirm whether or not you should enroll in Part B. If you're self-employed or not working and are either paying for private insurance or purchasing insurance through your state's health insurance exchange, you must enroll in Medicare when turning age 65. Lastly, if you are on Medicaid, you will also need to sign up for Medicare once you turn age 65. Your eligibility for continuing Medicaid as a supplement to Medicare will be subject to redetermination at that time. However, if you are covered as a current employee by an employer group health plan, either your own employer plan or that of a spouse, and that employer has more than 20 employees, you can opt to decline Medicare Part B until a later date. Finally, you need to consider Medicare Part D coverage, whether through a standalone Part D prescription drug plan or as part of your coverage under a Medicare Advantage plan. Although Medicare Part D is actually considered voluntary, there is a penalty for late enrollment. As long as the drug coverage you have under your current employer plan is considered creditable, which is defined by Medicare as just as good as Medicare coverage, you do not need to be concerned about late enrollment penalties. However, once you leave or lose that creditable coverage, you have 63 days to enroll in a Medicare prescription drug plan. Because Part D is voluntary, some individuals may choose to forego enrolling in a plan when they are first eligible, especially if they're not currently taking any prescription medications. This may prove problematic later on, however, when they need coverage, as they may need to wait for an open enrollment period and will also have a penalty if the 63-day period has passed. So where does one go to sign up for Medicare? Your local Social Security office is the place to start. You can access Social Security at ssa.gov and enroll online. You will need to set up a personalized mysocialsecurity.gov account in order to enroll online. You can also call Social Security and complete your enrollment by phone. Or you can visit your local Social Security office and complete your enrollment in person. The Social Security website has an office locator where you can search by zip code for the office that is nearest to you. As I mentioned before, plans can change, and we want you to be prepared for what you need to do under those circumstances. So let's look at some alternate scenarios. So say your plan was to work until age 70, but unfortunately your plan has been derailed by an unexpected job loss at the age of 67. What steps do you need to take? First, you want to contact Social Security as soon as possible to start the process of enrolling in Medicare. Remember, you do have that 8-month special enrollment period, but ideally, you want to time the start of your Medicare coverage to coincide with the loss of your employer coverage. So be sure to confirm exactly when your employer coverage will end. Medicare coverage always starts as of the first of the month you've enrolled. If you have already enrolled in Part A when you turn age 65, great. Otherwise, you should now be enrolling in both Parts A and B. Social Security will need proof that you had employer group health plan coverage from your 65th birthday until the last day of your current employer coverage. Providing them with this proof will protect you from a late enrollment penalty. You must have your employer complete CMS Form L564 to provide evidence of coverage. You can obtain this form on the Social Security website. You'll also need to make some decisions on how you want to get your Medicare coverage, whether enrolling in Original Medicare with a separate prescription drug plan or a Medicare Advantage plan which combines A, B, and D. If you are staying with Original Medicare, you may also want to review Medigap plans, which supplement Medicare costs by covering copays and deductibles. And finally, you should be aware that COBRA is not considered employer coverage, and it leaves you exposed on two fronts. It will not protect you from the late enrollment penalty if you have not signed up for Part B within that 8-month special enrollment period. And if COBRA insurers learn that you are eligible for Medicare while they are covering you, they may refuse to cover you and reclaim any payments made on your behalf. Shown here is an example of CMS Form L564. Again, you would need this form to be signed by any employer who had you participating in their group health plan after you had turned to age 65. The most critical information is what you see circled in red here. That is the dates of coverage under the employer plan. As long as this form shows you have had continuous coverage from your 65th birthday to the present, you will not need to worry about any late enrollment penalties from Medicare. Remember, too, that if you had more than one employer since turning age 65, you will need a separate CMS Form L564 signed by each employer citing the relevant dates of coverage. Along with Form L564, you will also need to submit a CMS 40B form, which is an application for Medicare Part B. This form can also be found on the Social Security website at ssa.gov. So now let's say you stopped working at age 66, followed all the rules we just talked about, and signed up for Medicare Parts A, B, and D. And now you've been offered a job where you're actually going to be able to join the employer's group health plan. In this case, you can request at Social Security that your Medicare Part B be suspended until you need it or want to pick it up again. If you have a Part D plan or a Medicare Advantage plan in place, it's your responsibility to contact those plans and cancel that coverage. And of course, you want to be mindful to time the changeover correctly so that you don't duplicate your coverage or leave yourself with any gaps in coverage when making that switch. And finally, let's look at what you should do if you delay your enrollment and your retirement past age 65 and your plan is on track to retire a few years later. Once again, your first stop should be at Social Security to apply for Part B as well as Part A if you did not previously enroll. You will need that CMS Form L564 from every employer who covered you after turning age 65. You'll need to decide how you want your coverage, Original Medicare with a Part D plan or a Medicare Advantage plan. You may want to look at optional Medigap plans as a way to supplement those Medicare costs that aren't covered. Whatever you do, do not bridge the time between leaving your job and signing up for Medicare by taking COBRA, as COBRA is not considered employer group health plan coverage, and you may be penalized and may have coverage declined. And to help you with all of these decisions, we urge you to make an appointment with a SHIP counselor in your area. So what kind of assistance can SHIP counselors provide? They can help you decide which path to Medicare is the best for you, Original Medicare or Medicare Advantage. They can explain what Medicare does and doesn't cover and what preventive services are actually available to you at no cost. They can provide information on Medigap options in case you do wish to supplement your original Medicare coverage. They can assist you in reviewing your prescription drug coverage initially and every year during open enrollment to make sure that the plan you select is giving you the best coverage for the lowest cost. They can check to see if you're eligible for a number of federal and state programs that help consumers with healthcare costs. And they can explain how late enrollment penalties work and help you understand what you need to do to avoid them. To find a SHIP program in your state, you can go to shiphelp.org and use the SHIP locator function to find your local program. From there, you will be directed to a counselor in your city or town that can meet with you and review your needs. SHIP counselors provide free, confidential, unbiased counseling to all Medicare beneficiaries and their families and caregivers. We hope this information has been helpful, and we hope you will consider a visit to a SHIP counselor in your area to help you navigate your Medicare journey. Thank you.